Brain metastases are a problem that we're seeing with increased frequency in the world of oncology. And the incidence is actually on the rise. 20 to 40% of all cancer patients are going to be diagnosed with some form of central nervous system disease or brain metastases, which is cancer that spreads from some other part of the body and goes to the brain. Really, we utilize all modalities of cancer care in order to treat patients with brain metastases. To illustrate some of the complexity of brain metastases, I'd like to introduce you to a patient of mine, Mr. Jim Garrity, who back in 2014 was diagnosed with diffuse metastatic melanoma throughout his body, including cancer that had spread to his brain.
When the diagnosis came through, I was stunned. I mean, I literally was knocked back because it was stage 4 melanoma. So that means from my chest up, I was loaded.
We had done a tremendous amount of work at the time of Jim's initial diagnosis in order to coordinate how best it was that we were going to be able to treat him. Jim's diagnosis happened outside of the window that we would usually be discussing these patients in, which is at our tumor board, which meets only once per week, calling all specialties, neurosurgery, radiation oncology, medical oncology, in order to coordinate all of Jim's care. His treatment had started promptly, which was within 2 days of his diagnosis. In most circumstances, we want a faster turnaround time than that. And we recognized, based upon Jim's case, that we did not have the tools that we needed in order to have an efficient conversation to outline a plan for care for a patient that needed immediate access to our services. We decided to do a pilot of our program on the inpatient setting before we had even created our Nimble mobile application. What we found from this pilot were really remarkable outcomes. We were able to decrease our patients' length of stay in the hospital by upwards of 40%. We decided that as opposed to looking for a commercially available product to allow us to have this real-time conversation, that we would build our own. And that is where the motivation for the Nimble app came into play. Nimble app is of incredible benefit to our patients. To see each of the individual specialties and disciplines that were necessary to manage their treatment. Now we can make that more streamlined. We quickly realized that the scalability of this application and the technology that it provides our colleagues is really limitless. This could have applications to cardiology, to diabetes, to neurology, to orthopedics and surgery. Any situation where multiple colleagues across multiple disciplines are needed to manage complex patients, the technology embedded within Nimble would be able to provide that tool for those providers to better care for their patients.
July of 2017, that's when they said, "You're clean." I was ecstatic. I was like, oh man, it's like a huge weight lifted off my back.